Now we're going to get into a lot more detail. First of all, it was designed for Medicare, and we started in 2006, but then we ran across some problems. What if, what if, what if? So here's what we've come up with. The government right now has things called medical entitlements. The first one is service connected. Okay, so you're in the service, you got your leg blown off. If that person that was disabled has a disability of 50% or more, then all of his medical, no copays, no nothing, it's covered under this entitlement by the VA. Now, they also created another entitlement system so that if you were in the service in any branch and you come to the VA, they're always going to have the door open for you. And there are, I don't know what you'd call them, maybe freebies, the things that you can get because you were in the service through the VA system that, in my opinion, are considered entitlements. There's another guy, though, called TRICARE. And everybody's heard of this, but maybe you might not know everything about it. TRICARE was originally designed for the families of the people on active service. Here you come out, you're going overseas, you don't want to worry about your family, so the government says, hey, we'll take care of your family, everything that's going on, and it's a great service. You get out of the service, you go back to normal, TRICARE goes away, and you live happily ever after. But if you got in there and you decided, now I'm going to spend 20 years. So for the 20 years, you had TRICARE, and when you walk out of the door at 20 years retired, you keep TRICARE for your family, all your dependents, for the rest of your life. Now, the same goes if you're in the military and you got 30% disability or more. Now you have TRICARE for your family. And now ChampVA came from the word champus, and what it's really about is if you're identified by the VA system as 100% permanent and total, then your family and you can get what's called ChampVA, which is in a lot of ways similar to TRICARE, and I'm not on both of them, but I think they're pretty similar. The copays are probably different, you know, percentages might be different, but basically the same. Now, Medicaid is kind of another one, but it's being paid by the state, and Medicaid is for some reason you are disabled, you can no longer function, you did not spend enough time putting money into Social Security disability, so you didn't meet the requirement to get Medicare. So Medicaid is picked up by the states, but pretty well dictated to by the government on the rules and things that you have to follow. And then naturally there's other systems out there like let's say our paid officials, the Congress and the senators. I don't know where they go for the hospitals, okay, but I know it's another one of these entitlements. The reason why I'm bringing this up is because when this system is in place and we're moving along, these government could be knocking on the door and saying, let's put these people in the system. It was originally designed for Medicare. Medicare is completely different than everything that I've talked about. They are not entitlements. What Medicare is we have put money into it. They have a huge amount of money still left in there. That money is sitting there, and it's used to pay for the health of our senior people. Now, the reason why we're going to have to get on the ball, and if they buy this system that we're selling, okay, let me make something clear. Nobody in my group, me or anybody, no kickbacks, no nothing. We are mostly military retired people, okay? We are people, one of them was a space scientist, rocket scientist, excuse me. We don't want anything, okay? We just want to make a better system for America. So don't get on the ball, you know, don't come up and say, we got a system, what's it going to cost? Not going to cost you anything from us, okay? But you have to understand that in 2011, The very, very first baby boomers will hit Medicare age. I don't know how many baby boomers we have, but they're going to come into the system from all sides. Now, under the current system, when they come in and they see a doctor, that's $2,455 on average per visit. Out of that, they're estimating right now that $100 billion per year is fraudulent. We're losing $100 billion a year. Now, just so that you understand, like I said earlier, if you took $2.7 million a day and multiplied it by 365 days, you'd get $1 billion. Now, if you take 100 billion, that would be moving the decimal point over, and what's that, $270 million a day that we're losing just in fraud? Okay, so this is not a pilot program. We don't want anybody to do anything except do the right thing for America. And this is the right thing for America because our hospitals are already owned. Now, one side saves money right now for the taxpayer. The other is the people that put the money in the system and it's in there, and they deserve it also. So there's going to be a contention about who gets served. So from this point on, we're going to assume that everybody's going to get served. Okay?